I am recording, Kelly. You can start anytime.
You're walking down the street and suddenly you have chest pain and you're short of breath. Your first thought is a heart attack, but it could be another serious condition called a pulmonary embolism. Today, I'm speaking with Dr. Catherine Foley, a vascular surgeon who's on location to learn more about this serious condition. Dr. Foley, thanks so much for joining us.
Thank you for the opportunity. I appreciate it.
So tell me, what is a pulmonary embolism?
A pulmonary embolism is a blood clot that's gone up to the lungs and blocks the blood flow. Typically, it originates somewhere in the legs as a DVT, or a deep vein thrombosis.
And how common is a PE?
It can occur in about 100,000 people a year, and typically those are the people that they see through the CDC that have died from it. So it probably happens more often than is actually noted.
What causes someone to have a pulmonary embolism?
The most common cause is a blood clot that goes from the legs somewhere up into the lungs themselves. You can get blood clots anywhere, but the legs are the ones that typically become the problematic ones up in the lungs.
So if someone has a DVT, what kind of symptoms might they be experiencing?
If you have a DVT, you'll notice that you have increased swelling and redness and some pain in the extremity that's affected.
Is there anything that someone can do to prevent them from getting a DVT?
Well, DVTs typically happen when a person is more sedentary. So whether they've just had a long car ride, a long trip or travel or airplane, a trauma or a surgery, those things can kind of be obviated by moving more if you can tolerate it or if you're able to do so. Other things like compression stockings tend to help. And then there's certain people who have genetic predispositions to having blood clots themselves, and those would be managed with medications.
So how would you diagnose if someone has a pulmonary embolism?
So typically to see a pulmonary embolism, that requires a CT scan. So the person's gone to the ER and had this high suspicion for something, and they get a CT scan to look directly at where the blood is flowing in the lungs and in the pulmonary arteries.
Are there different ways that would be treated?
It can be. So if you have a DVT or a PE or both, the number one treatment is anticoagulation, a blood thinner. Typically we start with something in the IV and then transition to something that's a pill by mouth. If you have a significant enough blood clot, whether it be in the leg or in the lungs, there's things that we look at to determine if your heart happens to be working too hard, if you do have a blood clot in the lungs. So the blood flow shortly of the lungs and the heart, it goes from the right side of the heart to the lungs to the left side of the heart and then out to the body. And we can see that right side of the heart working extra hard. It's called right heart failure or right heart strain. And if a person has that, they might qualify for a treatment to help dissolve the blood clot in order to help their heart pump better.
And if someone did get that kind of treatment, what would their recovery look like?
The recovery itself depends, but typically what can happen, you have a lot more tiredness and fatigue after you have the blood clot itself. Just even doing things like simple tasks that you might have been used to are a little bit more of a chore going forward until your body recovers from that area that was blocked.
So what would you tell someone that thinks they may be experiencing a pulmonary embolism?
If you're concerned that you have racing heart, shortness of breath, chest pains, or just that overall feeling of anxiety with all those things, definitely call 911 or get to your nearest ER. There's things that we can actually do up here in Port Huron now that we're working on so you don't have to be transferred out of the city. Typically in the past, people were getting transferred down to other sites if they had something like this, but we've worked on a program and I've done things that we're able to do this here and treat patients locally now.
That's great. Thank you so much for sharing this information. This really is an emergent case, and we're glad that you're here to keep us all safe and healthy.
Thank you. I appreciate the opportunity.
Okay. I am now recording. Do your thing when you're ready.
Okay. Dr. Foley, what are the symptoms of a pulmonary embolism? How common are they? I should redo that one because I went right back down to my clipboard.
Yeah, you need to just give us
a little more time.
To cut to her.
Yeah. So second question, retake. How common are they? What causes people to get pulmonary embolisms? What are the symptoms of a deep vein thrombosis or a DVT? Can anything be done to prevent a DVT or a pulmonary embolism? How do you diagnose if someone has a pulmonary embolism? How is a pulmonary embolism, how do you treat that? I'm going to re-ask it again because I can. How are pulmonary embolisms treated? What is a typical recovery for someone after they've had a DVT and a pulmonary embolism? And then, thank you so much, Dr. Foley, for sharing this information with our audience. And thank you for watching McLaren Port Huron Today's Health. We'll see you next time.
That was perfect. Just tighten it up a little bit because you paused after you said goodbye to the
Yeah,
doctor.
you like, yeah.
Oh.
Just make it all.
Oh, gotcha. So I'm going to redo the closing. Okay. Thank you, Dr. Foley, for sharing this information with our audience. This is very valuable information. And thank you for watching McLaren Port Huron Today's Health. We'll see you next time. Okay. Am I done?
You are done.
Yay.
You did fantastic.
Awesome.